than the doctors who are working in the hospitals. And as a result, some of these administrators can get paid more than the doctors. This is why healthcare costs are out of control, by the way. And although this book touched on it just a little bit, I would like to emphasize to you that this is the reason there are no jobs in America. No good paying jobs. Or at least they're dwindling, at least they're going down. And this is why a lot of not amazing jobs, but regular jobs, jobs that sustain economies, manufacturing jobs, this is why a lot of them are done in Canada. If you didn't know, I grew up in an area that was surrounded by box factories and some other factories, but box factories were a surprisingly huge, and still are a surprisingly huge industry in Ontario, Canada, and Quebec, Canada, and in Canada in general. And where do we send our boxes? We send them to America. Why doesn't America make boxes? You guys have forests? You have plenty of forests. You have Alaska, you have Montana. A lot of people living in the city, they hear that forests are in trouble and all this. Well, I promise, there's more forests than we've ever had on record, and we couldn't harvest all of it. Even in my province alone, we could supply the entire world with paper. We couldn't cut down 1/10 of the forest before it grew back. These are oceans of trees we're talking about, and America has access to them. They could even buy the raw material from us and then process it in America. These were viable industries, right? Auto manufacturing was a viable industry in America before healthcare costs got passed on to employers. And so the average employee might not realize how much of their economy is controlled by these healthcare costs, but I'm not the only one saying that it's because of health insurance that American jobs are no longer there. There's nothing fundamentally different about making boxes in Canada, except our healthcare costs are paid by the government instead of being paid by the employer. Yes, we pay higher taxes, but it still ends up being less than you guys are paying for private insurance and employment insurance programs. So back to the reading.